You know something, not for nothing, but when my father had his bypass surgery, and he went to NYU because my brother was on staff there at the time, they put him in this little box after the surgery is done. So I walk into the little box. Of course, my father's busy telling the nurses, "Oh, their son, the doctor, is there." You know, my father. But the point is that our hospital, for instance, you've had surgery. You've got bigger rooms. You've got a great staff. Our statistics are as good as any place in the city, and I found I could never have seen myself working in Manhattan. This is so much more pleasant environment, and I'm really not patronizing anybody, but our nursing staff. Notice I haven't mentioned our physician. No, our nursing staff is great. We have just a bunch of great people that I've worked with here, and I've made so many friends over 30 years here that I couldn't. I don't think I would have had that ability to do so in the city. One of your questions, and that was on apps for treatment of diabetes. Well, there's 1 million apps out there, and believe it or not, only very few of them have been validated. But more and more, there's so much research being done and so much work, heck, research, they're already doing it, where they have group visits, they do telemedicine, and a lot of it works pretty well, where you have groups and you have the specialists and they communicate with other groups. So in rural areas, they're already working on getting the person closer to the specialists. There's a whole bunch of stuff about that. I can't tell you about much of it in my work, but I know that I've been at meetings where they discuss that, and some really nice stuff they've done with telemedicine type applications. I remember that, I was a resident, and I was down in the dialysis unit. Now, this is brutal stuff, but it has to be said. And I was in the dialysis unit, and just most of them were diabetic. They all had fistulas, which clotted, malfunctioned, got infected. They had a miserable time on dialysis. They were blind. They had amputations. And I started with a simple question. I said, "Is this it? I mean, this is what we're doing in medicine?" I mean, I was just a resident. I said, "There's got to be something better than this." So I became interested. I started reading, and I went up to Joslin. Well, when I went there, the research had already started to show that, listen, there was a time when the concept of tight control preventing complications wasn't bought by that whole concept wasn't bought by everything. There was a New York school, there was the New England school. Well, I went up to train in the program where they believed in tight control, and you know who won that story. So I suppose that the thing that motivates me is trying to prevent complications, and we've already seen it. I mean, my patients that have a progressive kidney disease are already doing so much better than they used to do. My patients with heart disease benefit from we have a fancy heart and vascular hospital. The neat stuff they do is really something. They can put stents in vessels that you never think anyone could reach. And so the prognosis for a person with complicated diabetes is a lot better than what it was, for reasons of both better medication, better treatment, better insulin, and also we have better ways of approaching the complications. So what motivates me is, well, trying to make people better. How else can I say that?